How does one destroy the fasted cardio myth in 15 seconds or less? Well, if fasted cardio worked, you'd already be at your goals. 8 seconds. Awesome. The fitness industry is full of a ton of myths. One of those myths is that fasted cardio is far superior to any other form of cardio you can do. And if you do a quick little Google search right now, you're going to find up to 20% more effective than any other cardio that you can do. If you go to the Journal of the International Society of Sports Nutrition, you're going to find out it is not statistically different to do fasted cardio versus non-fasted cardio. One of the reasons for this is because your heart and lungs are going to do work for the remainder of the day after you do cardio. When I go back to that first point about you already be at your goals, some people wake up first thing in the morning and they have to slam their BCAAs to make sure they have proper amino acid saturation in their bloodstream before they go do their workout. Well, the problem with that is in some people, when you take BCAAs, your insulin level naturally goes up, which means your fat utilization goes down. So if insulin is high, fat utilization is low. For some of us, we're not getting enough sleep, so our fasting blood glucose is high. If your fasting blood glucose is high, your fat utilization is low. So we need to be more conscious about what we're doing. You're better off getting a little bit more sleep, making sure that your body is primed and ready for exercise. Don't worry about your amino acids before cardio because you can't burn muscle during cardio. And if anyone tells you that, especially if they're a trainer, fire them. There's 2 substrates that you can utilize during cardio, unless you have rhabdo or some other muscle wasting disease. You're only going to burn fat or carbohydrates during exercise. Now, if you are an ultramarathoner, there's a chance you could break down some protein. But most of the people watching this are just trying to drop 5 to 10 pounds. They're not trying to hit the trails for up to 100 miles. What we also need to consider is if you're not getting enough sleep, your stress levels get higher, which causes cortisol to go up. So there's one of our hormones for the day. So we've talked about insulin, we've talked about cortisol. As cortisol levels go up, stress levels naturally go up. As stress levels naturally go up, it becomes easier for us to burn sugar, not fat. Didn't say anything about eating it yet, so just stay with me on this. As your body breaks down more glucose and mobilizes more glucose, it's getting ready for fight or flight. What we need to be aware of is that fight or flight response is going to cause you to be more stressed out through the day, which is going to cause you to dump more sugar in your bloodstream throughout the day, which means you're going to keep moving and burning sugar while you're doing it. All of that to say, don't put a lot of pressure on fasted cardio. Focus more on cardio, getting moving. Focus more on recovering so you can have a better weightlifting session. Focus more on being low stress. The lower your stress levels, the higher the fat utilization. One thing that people always think about when they do cardio is lower intensity is better because it helps me burn more fat. Well, there's a problem to that. When we look at low intensity, sitting in a chair, standing up like I am right now, all those things are actually lower intensity and yield a higher fat burn percentage per minute, not a higher fat burn amount. What we have to do is we have to push our body. We have to become more aerobically fit. It's been shown that if you're doing cardio at 70% of your VO2 max, it will help with gaining muscle and losing body fat faster. So what does that mean? Make your heart stronger, make your lungs stronger. You'll get leaner faster.